Dr. Dwayne Ackerman is back with us today to share the benefits of something that may be new to you, and it's called dry needling. Good morning.
Good morning.
So what is dry needling? I have heard of it, and athletes use it, and so how do you use it, and what is it?
So dry needling is kind of a subset of acupuncture.
Okay.
And we use acupuncture needles. The way we use it in our office is primarily for acute pain relief and for myofascial pain. We use a lot for bursitis, arthritic joints, that type of thing.
So somebody comes in and complains about, my hip's hurting, my knee is hurting, and so how do you target that particular area? Because it sounds kind of general. Hey, my lower back is hurting.
Well, a lot of it comes from experience from treating patients for 35 years, knowing the important part about dry needling is knowing where to put the needle to get the benefit. So that's where just years and years of experience of hands-on patients is what makes it more effective for us.
And how, if people come in and do they get immediate relief, or is that something that comes in a bit after that nerve has calmed down?
Most of the time it's right away. And it's virtually painless to have done. I'm going to show you here.
Okay, we couldn't get any volunteers.
Yeah, nobody volunteered to do this. So it's really, it's very simple. The acupuncture needle is teeny tiny. So I don't know if the camera can see this, but there's a needle in there. And basically all you do is I just take this, and I'll just show it on my hand here, and just put the needle in.
You just tap it in there. So it is exactly like acupuncture.
Yeah, just like acupuncture. The difference is the placement of the needles versus acupuncture.
All right, okay, so what do you mean?
Well, so say if you had a headache, in typical acupunctures, they might put a needle in the top of your head, maybe in your arm, maybe in your ankle, and you lay there for 20, 30 minutes, and it's supposed to increase or decrease your energy flow. We're going directly to, like say, I do a lot of thumbs with this joint and this joint. We go right to the joint, and it gives almost immediate pain relief without the side effects of like a cortisone injection.
Right, a medication of any kind, right?
Yeah, because you can only get like one cortisone injection in a joint and be safe. Other than that, it starts deteriorating joints. So this is it's a painless, safe alternative to some of that type of therapy.
So do people ask you for it, or do you recommend it when somebody says, I've got carpal tunnel?
We've been doing it long enough that we have patients that ask for it. And part of the reason I thought about this was we had a patient who drove an hour and a half to pick a patient up to drive an hour and a half back for this, this week to do. So I was like, all right, we'll talk about this today.
No, I think it's important to have those options because, so often people come to you and they've been told there is nothing we can do about that headache, that joint pain, that whatever else, and they need an alternative, a path forward.
And there's patients that don't like taking the medication over and over and injections and all that. So they're looking for natural alternatives, and this is a great one for pain relief, from sinuses to headaches to I do a lot of hip bursitis in hips, a lot of arthritic joints in thumbs. We do a lot of it.
So how long do you leave those needles in there when people come for a treatment?
30 seconds to a minute.
Oh, wow, that is really nothing.
Yeah, but we may do, I may say on a thumb, I may put 4 or 5 needles in this joint, take them out, do that 2 or 3 times. But we do what's called superficial dry needling, which means the needle only goes in 1 millimeter or 2.
I mean, it's just barely there.
Right.
Right.
There is a technique called deep dry needling, which a lot of physical therapists are trained in, and it works okay. But that's where the needle goes deeper into the tissue, and that can be uncomfortable. I've tried it. The superficial stuff works just as well, and it's a lot less invasive.
Well, that is really good to know. So make an appointment if you think this is for you.
Yeah, just, call our office, get on our website, whatever, get a hold of us, and we can take care of you.
They'll take care of you. Thank you, Dwayne.
Yep.
We'll be back with more lifestyles and some strawberry pie right after this.